So today we're going to be covering Chapter 6, Environmental Emergencies. So heat stroke is life-threatening. Untreated heat stroke can result in death, and there are two types of heat stroke: classic heat stroke and exertional heat stroke. Classic heat stroke usually occurs in older people, people who are chronically ill or sedentary, people who take certain prescription medications, and people who may be abusing drugs or alcohol. And this is really common during heat waves, and we usually see that affected people will not sweat. For exertional heat strokes, these usually affect young, healthy people who aren't acclimatized to the heat, and these usually occur during strenuous activity. And sweating is prevalent in about 50% of affected people. People often confuse the difference between heat stroke and heat exhaustion. The main difference with those is heat stroke. Individuals who have heat stroke usually have an altered mental status, skin that's hot to the touch, and a body temperature of 104 or higher. Heat stroke is life-threatening and must be treated immediately. So what you want to look for is that extremely hot skin that's usually dry, but may be wet related to strenuous work or exercise. What you're going to want to do is move that person from the hot environment to a cooler, shaded area. Call 911 immediately. A person who cannot be taken to a medical facility quickly should be cooled by any means possible. So we're going to go through the order of effective cooling from most effective to least effective. So our most effective cooling method is going to be whole body cold water immersion. So first you will remove the clothing down to that person's underwear and then have them submerged, their body and extremities up to their neck in a bath of cold water or tub of ice water. And the colder that the water is, the faster that rate of cooling is going to be. You could also have that person lay down on a plastic sheet or tarp and hold the sides up and apply water and crushed ice. Keep the sides of the tarp upright to keep the mixture in place and move the tarp to keep the water moving around the person. You can use a natural body of water like a stream or river to submerge a person to help them cool off. Do not leave someone suffering from heat stroke alone in a body of water, as it can be dangerous. You could spray or douse cold water repeatedly on the person's skin and fan vigorously, though this method is half as fast as immersion cooling. You could use ice packs to cover the entire body. If chemical cold packs are used, then they should be applied to the cheeks, palms, and soles rather than the skin covering the neck, armpits, and groin. Ice packs have a greater cooling capacity than chemical cold packs. Stop cooling when mental status improves after 20 minutes or when emergency medical services arrive. Do not give ibuprofen or aspirin. While these can be helpful in cases of high body temperatures caused by diseases, they are not effective with a heat-related illness. Heat exhaustion differs from heat stroke because the person has no altered mental status and their skin is clammy, not hot. Like heat stroke, you should still cool that person, just not as aggressively as you would for heat stroke. Uncontrolled heat exhaustion can evolve into heat stroke, though. You're going to want to look for pale or ashen skin, clammy or sweaty skin but not hot, severe thirst, fatigue, dizziness, even flu-like symptoms such as headaches, body aches, nausea, and sometimes vomiting, shortness of breath, and rapid heart rate. So what to do? You're going to want to move that person from the hot environment to a cooler, shaded area. Remove excess clothing. Spray or douse cold water on the person's skin and fan vigorously. If the person is able to swallow, you can give a commercial sports drink, a fruit juice, or lightly salted water. If none of those options are available, give cold water, but do not give salt tablets. If 911 improvement doesn't occur, or sorry, call 911 if improvement does not occur within 30 minutes. Now moving on to heat cramps. What you're going to want to look for is painful cramps in the abdominal muscles or extremities and heavy sweating. You're going to have that person rest in a cool place, give lightly salted cool water, and you can make this by dissolving a 1/4 teaspoon of salt in 1 quart of water or a commercial sports drinks. Do not give salt tablets. Lightly stretch and massage the cramped muscle and apply an ice pack to the cramped muscles. Heat syncope. So you're looking for dizziness or fainting. If the person is unresponsive, we're going to check their breathing. A person with heat syncope will usually recover. If the person fell, you're going to check for injuries related to the fall. And you're going to have that person rest and lie down in a cool area. You can wet the skin with a damp, cool cloth or by splashing water on the face. And if the person is not nauseated and is alert and able to swallow, you can give lightly salted cool water. And again, do not give salt tablets. Heat edema. What we're looking for here are swollen ankles and feet that occur during the first few days in a hot environment. And you're going to have that person wear support stockings and elevate their legs. For a heat rash, we're looking for an itchy rash on the skin that is wet from sweating. And you're going to dry and cool that person's skin and limit their heat exposure. Hyponatremia, what to look for here. So this is a person who has drank too much water. And what we're looking for here is vomiting clear fluid, profuse sweating for long periods of time, frequent clear urination, dizziness, weakness, nausea, headache, altered mental status, and severe sodium loss that may result in seizures or unresponsiveness and can be fatal. So what you're going to want to do is move that person to a cool location. For a person with an altered mental status, call 911 and seek professional medical care. Do not give more fluids. Give salty foods. Do not give salt tablets because they can irritate the stomach and cause nausea and vomiting. Poisonings. Most poisonings have little toxic effect and are rarely ingested in such small amounts that severe poisoning rarely occurs. Still, the potential for severe or fatal poisoning is always present. For a swallowed poison, we're looking for abdominal pain and cramping, nausea or vomiting, diarrhea, burns, odors, or stains around or inside the mouth, drowsiness or unconsciousness, and then a poison container nearby. So first we're going to try to determine that person's age and weight, what condition they're in, what poison was swallowed, when the poison was taken, and how much was taken. For an alert and awake person, call the poison control hotline at 1-800-222-1222, even if signs of poisoning are not present. Place the person lying down on their left side to delay the poison from moving into the intestines and to prevent the inhalation of vomiting if vomiting occurs. Monitor breathing, and if absent, begin CPR. Now, cautions. Do not give anything to eat or drink unless advised to do so by poison control or by a professional healthcare provider. Do not try to cause vomiting by giving syrup of ipecac or by gagging or tickling the back of the person's throat. Do not give activated charcoal unless advised to do so by poison control or a professional healthcare provider. Do not give water or milk to dilute poisons other than caustic or corrosive substances like acids and alkalis unless instructed by the staff at poison control. For an inhaled poison, we are going to look for a headache, ringing in the ears, chest pain, muscle weakness, nausea and vomiting, dizziness and visual changes such as blurred or double vision, unresponsiveness, respiratory and cardiac arrest. Indications of possible carbon monoxide poisoning are symptoms that come and go, symptoms that worsen or improve in certain places or at certain times of the day, similar symptoms in people around the person who is ill, and pets that seem ill. So what you're going to want to do is call 911 as soon as possible. Try to determine what substance was inhaled, when the exposure occurred, how long the substance was inhaled for, and the person's condition. You're going to place that person sitting in a reclining position or whatever position is going to best facilitate breathing and is comfortable for them. You can support the back for easier breathing. And you're going to monitor their breathing, and if it stops, give CPR. Now for drug emergencies. Opioids are a classification of drug that relieve pain. They can also trigger the release of endorphins, which are natural chemicals that boost happiness and are highly addictive. Like all medications, people can have adverse reactions to opioids. Because opioids slow or even stop breathing, drug overdoses can be fatal. Most opioids are narcotic pain relievers such as morphine, heroin, methadone, fentanyl, and oxycodone. A drug overdose can happen when a person misunderstands the directions for use, unintentionally takes an extra dose, or deliberately misuses a prescription opioid or an illicit drug, takes an opioid medication prescribed for someone else, or mixes opioids with other medications, alcohol, or over-the-counter drugs. What to look for: extreme sleepiness or drowsiness, unresponsiveness, breathing problems ranging from slow and shallow breathing to no breathing at all, lips and nails turning blue, skin that feels cold and clammy, extremely small pupils. So what to do if you suspect an opioid overdose? When an unresponsive person is known or suspected to have taken an opioid drug, first we're going to check for breathing. If the person's not breathing or is only gasping and there is someone to help, have the other person call 911 and get an AED or naloxone while you begin CPR. If the person is not breathing and only gasping for air and you're alone, complete 5 cycles of CPR before leaving to call 911 and getting an AED and naloxone. Give naloxone if available. Naloxone is a safe medicine that rapidly reverses a drug overdose. It is easy to use, and it only reverses the effects of opioids. It has no effect on other drugs such as alcohol or stimulants. Do not delay giving CPR or compression-only CPR to an unresponsive person who is not breathing while waiting for naloxone to work. Naloxone is available in 2 different forms: a pre-filled single-dose nasal spray and a pre-filled single-dose auto-injector. To administer a pre-filled single-dose naloxone nasal spray or Narcan, place the person flat on their back with their head tilted backwards. Administer the spray into one nostril. If there is no recovery within 2 to 3 minutes and another nasal spray device is available, repeat the dose in the other nostril. To administer pre-filled single-dose naloxone auto-injector, pull the device out of its case. Once activated, the device provides voice directions, similar to an AED. You're going to inject the person's outer thigh, similar to an EpiPen, which can be given through clothing if necessary. If the electronic voice directions do not work, the device can still deliver the naloxone dose. If there's no recovery within 2 to 3 minutes and there is another auto-injector available, repeat the dose. If naloxone has been given and the person becomes responsive and breathing, monitor breathing, and if breathing stops, begin CPR. Be sure to stay with the person until EMS arrives. The person should receive medical care even if they have recovered. If naloxone is not available, stay with the person until EMS arrives. Place the person on their side to keep the airway open. Monitor breathing, and if breathing stops, begin CPR. If possible to do quickly and safely, try to identify the drug. Look for medicine bottles or ask bystanders. The effects of the opioid often outlast the effects of the naloxone, and a second dose may be required. Some opioids are strong and may require multiple doses of naloxone. Anyone who is taking opioids or is at risk of an overdose should carry naloxone in case of emergencies. All 50 states allow the purchasing of naloxone without a physician's prescription. Most states allow behind-the-counter purchasing of naloxone. And that is all for this one.